Dr. Bedegal, the floor is yours.
Great. So I'll now call the Board of Health meeting to order. It is 6:30 p.m. We're going to start with the roll call of members. So please just say here when your name is called. Dr. Marla Gold. Dr. Gold, I can see your photo but not hear you.
Here, sorry, we had to unmute. We had to have that option. Thank you. Here.
Dr. Hamid Ismail. Oh, he is muted but gesturing.
Now we can unmute. Yes,
Okay,
I am here.
thank you. Dr. Jennifer Ibrahim, I believe is absent this evening. Dr. Tyra Bryant Stevens, also absent this evening. Dr. Ana Diaz-Rue.
Here, sorry, couldn't unmute.
Dr. Ayla Stanford is absent this evening, and Dr. Scott McNeil.
Here.
Great, thank you. And I'm going to turn things over to Ben Hartung to explain the public comment process.
Thank you, Dr. Bedegal. Good evening, everyone. My name is Ben Hartung, and I am a public policy advisor for the Division of Chronic Disease and Injury Prevention with the Health Department. And I'm helping facilitate the public comment process tonight. If you have a public comment related to anything on the agenda tonight, there are two ways to submit it. One is to email me at benjamin.hartung@phila.gov. That's benjamin.hartung@phila.gov. And another way is to use the chat function in this Zoom webinar. The Board of Health is required to review your comments prior to any votes on the agenda items tonight, but it is not required to respond or engage with your comments or questions. I would also like to let you know that this meeting is being recorded, and your participation in this meeting is consent that you will allow yourself to be posted online on YouTube after this meeting concludes pursuant to city ordinance. Thank you very much.
Great, thank you, Ben. So I'd also like to announce that the board just met in executive session to receive consultation with attorneys in the law department in connection with litigation related to the flavored tobacco ordinance, section 9-639 of the Philadelphia Code, and the Board of Health regulation related to the sale of flavored tobacco products, and regarding litigation related to the emergency orders addressing COVID-19. Has the board had a chance to review the meeting minutes? And are there any questions?
No questions. Yes, reviewed.
I would like to move to approve the minutes for this evening.
I second that.
All in favor of approving the minutes?
Aye.
Any opposed? Great, thank you. So there has been a change to the posted agenda. The following agenda items will no longer be presented to the Board of Health this evening. Firstly, the fourth consolidated and restated supplemental emergency regulation governing the control and prevention of COVID-19, revised consolidated safety measures for full reopening and delegation of authority. And secondly, the second amendment concerning the effectiveness of the emergency regulation governing the control and prevention of COVID-19, mandating vaccines for individuals working and dining at indoor dining locations, as amended January 4th, 2022. The first agenda item from the original agenda, the rescission of regulation relating to the sale of flavored tobacco products, will still be presented tonight. Do I have a motion to remove from the agenda both the fourth consolidated and restated supplemental emergency regulation governing the control and prevention of COVID-19, the revised consolidated safety measures for full reopening and delegation of authority, and the second amendment concerning the effectiveness of the emergency regulation governing the control and prevention of COVID-19, mandating vaccines for individuals working and dining at indoor dining locations, as amended January 4th, 2022. And
sorry.
One more second. And to add to the agenda, the emergency regulation rescinding the April 14th, 2022 emergency order temporarily reinstating masking requirements in certain circumstances to prevent the spread of the 2019 novel coronavirus, COVID-19. Is there a move to make those agenda changes?
So moved.
Is there a second?
I'll second that. I don't know who's the first. It's Marla, maybe the first. I was
Marla
the
was the
second.
first. All in favor?
Aye.
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 Any opposed? So I'm going to turn over to Ben to present the flavored tobacco rescission regulation.
Thank you, Dr. Bedegal. And one moment while I share my screen here. Is everybody able to see my screen?
Yes.
Okay, great. The first agenda item on the original agenda was the rescission of regulation relating to the sale of flavored tobacco products. This rescission is happening pursuant to a court order that was handed down by Judge Jean Prater in the case of Cigar Association of America et al. Versus the City of Philadelphia. Pursuant to Judge Prater's order, the city is required to void and withdraw any and all regulations regarding bill number 180457. And also to rescind, and that requires the Board of Health to rescind the Board of Health regulation relating to the sale of flavored tobacco products, which was filed originally with the Department of Records on August 13th, 2020. This order includes a statement from the Board of Health that they are doing so pursuant to court order, but that the principles of the regulation and the board's reasoning for passing them in the first place still exist. So I would just like to leave this on the screen for a minute for everybody to read it, but then I will pass it back to you, Dr. Bedegal, for a vote.
And were there any public comments related to this regulation?
1 second, I will check. I do not see any public comments at the moment for this regulation. No.
So I'll give a moment for the board to review. So is there a move to vote for the rescission of this regulation based on the requirement of the court order?
I'll move.
Is there a second?
I second.
All in favor? Aye.
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 All opposed?
Aye.
Dr. Gold, I don't think we've heard your vote.
Sorry, I'm having a meeting. Here, you hear me now? Can you hear me now?
Yes.
Sorry, and we're actually voting on the motion now. We're voting on the
Yes,
rescinding.
we're voting on rescind.
Yes, my vote is a firm no. I'm voting no.
Understood. All right, thank you. We are now going to turn our attention to the second vote related to the masking regulation. And before Ben walks through the details of this regulation, I wanted to talk with the board. I know you have earlier today seen our most up-to-date data. And I do want to mention that I spoke earlier today individually with Dr. Stanford, with Dr. Brian Stevens, and with Dr. Ibrahim, who all couldn't be here this evening, but of course are very interested in this important issue. We're in a situation that we really had not anticipated being in this soon, but it is good news. And when we announced that we would be mandating masks, made that announcement with a week of advance notice to give people time to be ready, but also wanted people to be aware of the risk. That appears to have had an effect, and Philadelphians do appear to have stepped up, which is really very, very encouraging. And what we're seeing now is that cases have leveled off and our hospitalizations have actually decreased. So the hospitalizations peaked on Sunday at 82. That was a marked increase from 1 week earlier when we were at 46. We are now down, as of today, down to 65 people in the hospital with COVID in Philadelphia hospitals. So a 25% decrease. So this is really very encouraging. It is quite different from what's happening around us in the rest of Pennsylvania and in other states, where we are seeing hospitalizations continue to edge up. So I'm really very happy to be here with you tonight to say it appears that we no longer need to mandate masks in Philadelphia and that we can actually move to simply a strong recommendation. We've said consistently that we didn't want to be any more restrictive than necessary, that if hospitalizations did not rise or did not continue to rise after the initial rise in cases, that we would rethink our metrics. And I think this is the moment when we should consider doing that. So Ben, can you walk through this regulation?
Yes, one moment, I'll share my screen again. And is everyone able to see my screen?
Yes.
Great. So as Dr. Benegal just explained, this is an emergency regulation rescinding the April 14th, 2022 emergency order temporarily reinstating masking requirements in certain circumstances to prevent the spread of COVID-19. And this regulation goes through to explain the history of prior emergency regulations, and then also starts to note what the commissioner has just laid out about the beginning of encouraging masking again that occurred on April 4th. And then it acknowledges that on April 14th, the commissioner issued an emergency order that temporarily reinstated a masking requirement in Philadelphia effective April 18th. And it goes through to explain that the case numbers in Philadelphia since the April 4th and throughout until today, I should say, that in this whereas clause that I'm highlighting here, as of April 21st, 2022, after increasing for the last few weeks, the average daily case count for reported COVID-19 has plateaued. After a steady increase, COVID-19 related hospitalizations have fallen from a high of approximately 82 on Sunday, April 17th, 2022, and to approximately 65 as today, which is a 25% decline in the last 4 days alone. And because of that, the board has determined that it's appropriate once again to strongly encourage but not require the use of masks in public indoor locations. And so this regulation is a rescission of the April 14th emergency order that was effective on the 18th.
So I will say that in my conversations, each individually with Dr. Stanford, Dr. Ibrahim, and Dr. Brian Stevens, they were all supportive of this move. This is basically a decision that, you know, the metrics which we created in mid-February based on the situation on the ground then are no longer what we need right now. And so we would shift to this strong recommendation for indoor masking. You know, I think that it is useful for us to tell people when cases are shooting up to be able to make a public statement, to be able to let people know this is the time to be cautious. But it appears that Philadelphians are able to listen to that well, respond well. And so I think this does make sense at this time as a response to the data. Are there any public comments that we should review?
Yes, we have received public comments in the chat that the board members should be able to review.
And I just realized also, I didn't ask if the board members wanted to either discuss or have any questions.
I have no questions at this time. If you can hear me, I think that the data speaks for itself, and that Philadelphians' understanding of the warnings and the situation that we're in, that it's an ongoing situation, shows that it's effective and that they can continue to listen to the data as it's presented. And my understanding is that we will, separate from this, be in discussions about appropriate metrics moving forward. COVID continues to be an evolving and changing situation, different variants, different scenarios, and I appreciate that we'll be taking that into account moving forward.
I just want to clarify that this is not a permanent rescinding of the decision to wear mask. It is depending on the data and the statistics, and if there is an increase, there will be another review of that, I assume.
Well, so this would be a rescission of the regulation that, with specific numbers, we would go to indoor masking, which is kind of what we had put in place in mid-February. If there was ever a severe new variant that put Philadelphia at high risk, would we ever mandate again? I think is a different question, but it's hard to say never ever. But I think what we've seen here is that the disassociation of hospitalizations and cases that we were waiting for appears to be happening, and that people have responded in ways that drive down hospitalizations. I think that, and that somebody is saying this in the chat, and I think it's absolutely true. This isn't because of enforcement starting 3 days ago. It's the response earlier than that of people being aware that there's something going on. They need to take action, be more careful. Clearly, that's I think what we're seeing here. So, it is a rescission of the existing metrics that would require masking at a certain level.
I just want to note that I think this shows that the department is behaving responsibly and doing what it needs to do, looking at the data and making the recommendations that it feels are most important at a given time based on the information that we have to protect the health of the residents of Philadelphia. So I commend you for doing that and being flexible and adapting to how this pandemic is evolving, which is always changing. So I commend you for that. For taking your job so responsibly. So thank you.
Thank you. Right. So if there are no further questions or discussion, is there a move to approve the rescission?
I move.
Is there a second?
Second. It's hard to come off mute. Sorry.
We're all struggling with our mute buttons tonight. All in favor of rescission?
Aye.
Aye.
Any opposed? Great. Thank you.
Thank you.
So I believe, Ben, correct me if I'm wrong, I believe that concludes our agenda for this evening.
That is correct.
So it is now 6:48 p.m. Thank you all very, very much. Thank you to the members of the public who attended, and have a good evening.
Thank you.
Aye.